Going into medicine, you've been chasing this dream for so long. My number one motivation for residency, number one important thing for me was the program and my education. There's a lot to offer here, and they really have kind of figured out how to train well, how to live well.
There is no place in the world that offers the degree of medical training, education, and research that we can perform at Mayo Clinic. This is a special place.
Mayo Clinic's urology program is a 5-year program with the optional research year for residents that are highly motivated to get something done during that year. I've had the opportunity to train and work at many different institutions, and I can say hands down, this is the best urology program in the country. It is one of the few programs where you'll get to meet your patients in clinic beforehand, diagnose them, talk to them about surgery, counsel them, take them to surgery, and then see them and follow up. There aren't many places where you're going to get that start to finish follow through, and that's as close as you're going to get to when you're actually out in practice.
The mentorship model is very unique to Mayo Clinic. You learn how that particular surgeon operates, your mentor, and not only do you learn how to operate and how to be a good urologist, but you also learn the nuances of that particular consultant and the way they do things, and you can take those good pieces and integrate that into your own practice. And what's important in this is it doesn't matter if you're a PGY2 or you're a PGY5 or you're a fellow, those are your patients.
We don't just do robotics, we lead in robotics. We want to train you to be doctors, to be surgeons, to have our trainees focus on what they need to learn, and they need to learn the clinical and procedural portions of urology to truly excel. We want to train leaders in endoscopic surgery, in laparoscopic surgery, in image-guided focal therapies, and in open surgery. So it's critically important that our trainees have exposure to all of these different approaches.
If somebody just came into the operating room once in a while, we wouldn't know what their skill level is. When I have somebody for 8, 9, 10 weeks straight, I can really see where they start and teach them things to make them better as they go along. So by the end, every one of our trainees leaves here ready to hit the ground running, whether they're going off to fellowship to fine-tune some skills, or if they're going off to private practice.
I would say there's a hidden curriculum to learning from one person for a set period of time, and part of that hidden curriculum is learning how your mentors manage their time, how they make time for research, how they structure their administrative tasks, how they interact with staff for consults, how they interact with nursing to deliver appropriate patient care. And so certainly a lot more is learned from being with them than just how to do the surgeries that they're experts at.
One of the things I've been the most excited about at Mayo Clinic is the learning environment in general. It's an environment where everyone is willing to teach you. It's an environment where everybody, no matter what level you are, is a part of the team, and everyone really emphasizes that culture here, which is exciting as a trainee. It gets you involved in all the things you need to see in surgical training, and it's really an excellent culture to be a part of.
Over the last 5 years, we've implemented a skills and task training and simulation program that you could argue is next to none. We have a mastery lab on campus that's over 60,000 square feet. It has a Da Vinci Xi robot. It has 5 microscopes. It has the ability to do cadaver work on demand. You can go to a vending machine and pick out your suture and spend time doing different tasks. It has multiple endoscopic simulations. And so having the ability to do that additional skills and task training outside of the OR only is going to make you better when it's game time.
One of the strengths of Mayo's research program is its breadth. So typically what we do is we have our residents and fellows meet with various faculty to discuss research areas of interest, and oftentimes residents will choose multiple faculty as mentors for different types of research projects that they might find of interest to themselves, be that basic science, be that health care research or health policy research, health economics, or health science research.
There's so many options, so many opportunities to do research. I'm already involved in a couple of projects, and I've just been here a few months. So the opportunity is endless, and I think everyone is very encouraging as well. So they want you to get involved. They want you to, write papers, go to conferences, and the program really supports you to be able to do that. I think one of the most amazing things funding-wise is that we get 10 days a year to go to conferences. So that's really motivating because those are, not days off, but days to travel, days to learn.
Mayo Clinic Urology also has a big emphasis on education, and we do have protected time for that as residents. Monday morning conferences, which range in topics, includes oral board preparations, it includes M&M or morbidity and mortality conferences. We also have on Thursdays topic-oriented journal clubs, which in addition to reviewing pertinent articles to the field, it's what the guidelines are. And it's a very useful protected education time that we have.
Mayo has a huge commitment to patients' care, education, and research. Working at Mayo Clinic helps me to connect with different cultures and people from all over the world. So if you want to provide care or you want to learn in a place where you can feel that you are treating everyone regardless of their culture, regardless of their resources, regardless of their background, it's Mayo Clinic is the place where you would feel safe to do that, and you'll feel very happy to provide care to everyone.
I think our program has been exceptionally supportive, both during my pregnancy and now that I've come back to work and I'm pumping and breastfeeding my baby exclusively. Having a program that is so willing to support you and make it, incrementally easier in certain instances, I think was so important to me. Everyone checked on me while I was gone and was super happy when I came back. I feel like my baby is part of the urology family.
I think number one priority for a trainee should be to get a good surgical experience during their residency training. Now, that being said, one of the beauties of being in a large program is that you can share a lot of that call burden with your fellow colleagues. And that really, I think, speaks to quality of life for our trainees. That allows them to have a life outside of work, which I think is an important part just to being a whole person and a good provider.
This is an amazing place to live. And even though you might not see yourself in the middle of Minnesota, all of the residents that come here, who come from all over the country, come here and really embrace Minnesota life.
I think there's a lot of general pros to Rochester, and the way I like to condense it is it's really easy to live here. In residency, you need to have fun things that are accessible easily to you. So whether that's going out for a beer with your friends, whether that's going to a theater show, hanging out at an artist's market or the farmer's market, those are all things that are super accessible in Rochester, and part of the reason I love living here.
I didn't know what to expect from Minnesota. I come from a coastal state. Everybody here is just so nice. It's a Minnesota nice, and it's real, and everybody wants to help you. A lot of people are associated with Mayo Clinic in and around here, so you always find a helping hand.
When I decided where I wanted to go with residency, it wasn't just, my decision ultimately. There was a partner involved, and so he moved out here with me, and number one thing, the living accommodations here are plentiful, they're affordable, it's easy as a resident on the salary that we have, so it was a really easy transition.
There are so many things you'll get to enjoy for this very short period of time, and then go off and live and practice wherever you're going to for the rest of your career. Come to a place like this, experience what we have to offer, and at the end of the day, everybody leaves here an extremely well-trained urologist.
So my best advice to give someone applying to urology this year is to relax. Enjoy the process and create friendships within this group, because these are people that you'll be working with through the rest of your career.
Every day that I come into work, I'm grateful to be here and kind of in awe that I'm training here. I feel grateful to take care of our patients. I'm grateful to learn from staff who are world experts, and it really doesn't feel like it gets better than this.
One of the most gratifying things of our job is to watch our trainees and how successful they go on to be once they graduate.
I would say the strength of our program comes from the faculty and the diversity of offerings that we provide our trainees, with really the goal in mind that we prepare them to be outstanding clinicians, terrific doctors, great people, and leaders in the field going forward.